Hi, this is Samar Aswani presenting a video for the Smart Study Hub on COVID-19. The coronavirus is a family of viruses, and COVID-19 is a newly identified type of coronavirus. So this is going to be the contents of what we're going to be discussing today in this video. First, we're going to be discussing the symptoms, and then how to prevent the spread, then the diagnosis and treatment, and then statistics and the current situation. So on this page, you can see the symptoms of the coronavirus. The most common symptoms being a fever, dry cough, tiredness. Less common symptoms being aches and pains, sore throat, diarrhea, conjunctivitis, headache, loss of taste or smell, a rash on the skin. And here are some of the serious symptoms, which are difficulty breathing, chest pain or pressure, and loss of speech or movement. If you experience any of these symptoms, you should contact your nearest doctor. Preventing the spread. There are several things you can do to prevent the spread of the coronavirus. One of the things is you should regularly wash your hands. You could social distance and also self-isolate. Self-isolation means staying at home and only going out for necessities. Social distancing, you just maintain at least a 1 meter distance between yourself and other people next to you. This is to prevent you breathing in liquid droplets that may contain the virus. Regularly washing hands can kill any virus particles that might be on your hands. Avoid touching your eyes, nose, and mouth. Your hands can be contaminated with the virus as they touch a lot of surfaces when you go outside and you're doing activities. So, if you avoid touching your eyes and mouth, this can prevent the virus from entering your body through your hands. Another thing you can also do is seek medical attention. If you seek medical attention, you can stop the spread of the coronavirus as soon as you develop symptoms, instead of staying at home and hoping they disappear by themselves and then spreading the virus to others who you come into contact with. You would be sent to the hospital and isolated from other people. So this would stop the spread of the virus. So here are some current age-related statistics. As you can see, the mortality rate increases as you get older. So ages from 0 to 17-year-olds only make up 0.606% of the share of deaths, while 18 to 44-year-olds make up 3.9% of the share of deaths. 45 to 64-year-olds make up 22.4% of the share of deaths. 65 to 74-year-olds make up 24.9% of the share of deaths, and 75 plus makes a 48.7% share of deaths, which is almost 50%. So as you get older, we can clearly see that the mortality rate increases. So as you can see, the virus is clearly more dangerous to people who are older, particularly above the age of 45. So now we're going to be talking about the distribution of cases. As you can see, currently United States, Brazil, Russia, India, Middle East, and some of Europe have a large number of cases. However, places like Australia, New Zealand, China, Greenland, all don't have as many cases now and are starting to ease restrictions in their countries. However, even though these countries may not have as many cases now, there's always fear of a second wave of cases coming on once restrictions are eased. So the question is now, is there a treatment or a potential vaccine for the coronavirus? So currently there is no treatment for COVID-19. The WHO, which is the World Health Organization, recommends that if you feel sick, you should rest, drink plenty of fluid, and eat nutritious foods. Stay in a separate room from other family members and use a dedicated bathroom if possible. Clean and disinfect frequently, touch surfaces. So this is in order to prevent the spread of the COVID-19 if you have it to your family members and to keep them safe. However, there is a hope in the future as there are currently 23 companies working on vaccines for the virus and several drugs in testing. We predict that by possibly December or January there should be a vaccine, as Donald Trump stated, and there should be a few drugs to help out with the treatment of the coronavirus. Okay, thank you for watching this video. I hope this informed you about COVID-19. And just remember, stay home, stay safe.